Hello and welcome. This is Dr. Gerard Cuomo. I'm here in my Boca Raton office with another rescue case. This is a case that was referred to my office for abutment, fractured abutment screw to be removed, and the tooth or implant number is number 12, identified as a Brannemark. Let's take a look now in the mouth. We've already taken our preliminary x-ray and a little description about the case. We have a locator case, and basically on top of a Brannemark, one of the original Brannemark fixtures. So this is the fixture, there's the fractured. A little bit of air, please. And we notice that there's no damage to the top of the implant, so that's good news. Our job is to remove this piece. It's currently about 1, 2, 3, 4, about 5 threads down, so we don't want to push it down any further and have it drop into what they call that blank or dead zone. Hopefully it's not down in there. We'll pre-soak it with tartar and stain remover and some penetrating oils, and hopefully we'll be able to back that out. If not, we'll have to drill a hole, tap a hole through the middle of the tooth, and remove it by mechanical means. All right. So first step is tartar and stain. So we're going to place that, give it about 5 minutes of soaking time here, maybe a little bit longer. Pre-soaking works really well. I'm going to ask for a smaller diameter. Today we have the luxury of different size micro tips, so I'm going to ask for the smaller diameter now. What you need to watch is the color of the solution itself. It should go from a clear to a kind of like a cloudy, and right now you can see how cloudy it is. All right, so one more. Once in a while, not always, but we're able to see bubbles come up. All right. So we'll set a timer now for 5 minutes. Been doing this procedure since the early 2000s, so we're almost 20 years at it. Rescued hundreds of cases. They all vary from simple, where we might see the screw move now and then we're able to back it out with an Explorer. We try to sharpen all these Explorers, make sure they're super sharp, so when it does, when you get a better feel for the top of the broken screw, you're better off using a sharp instrument. I don't believe we had a prior attempt here on this one. I believe the dentist just decided to get the patient referred to me so he can get back to his office for the next step, which is to add a locator attachment to this. We'll also use, instead of normal suction tips, we'll use micro suction tips. And we'll give it another couple more minutes here. Again, look at how nice and murky that water is in there, that solution. We know it's penetrating. We know it's doing what it's supposed to do. I'm using a large 2.5-inch crown and bridge mirror so we can let more light in. Microscope is a Leica MS5 microscope used with several levels of magnification. Right now I'll give you the difference. This is 8 power. Normal dental loops are right about 3.2 here. We can go up to 5, and then park it at 8 power, and then this will bump all the way up to 20. So that's at 20. All right. I think my patient's very comfortable now. He's starting to relax. That's good. Doing okay? Awesome. Okay. Well, it's all about anticipation, but this is where you want to trust your brain so much, not so much your eyes. So patience is a virtue. You want to just wait and let it penetrate. All right. While we're waiting, I'm going to come off the mouth. We're going to take a look at the denture itself. A really nice denture that was made by his dentist. It's an overdenture, but he has metal reinforcement, and also here are the 4 locators, and they were positioned slightly lingual to his teeth, so that had to be worked out. Looks like this one on this lateral incisor area was a little further away. Again, though, you know, you have to put it in bone, so. And here's the lingual aspect. These are all plastic teeth. You can see the amount of wear occurring. Let's see what he has on his lower. So his lower dentition, he's wearing a fixed appliance. This is an all-on 4 or 5. If we count the number of fixtures on the lower, he's going all the way back to the molar, so there's some hiding underneath here. So there you see an access hole there, one there, one there. So this is a fixed hybrid, or what they call an all-on 5 or all-on 6 hybrid denture. You can see how the teeth are kind of worn down here. After a while, sometimes what they'll do is they'll just take time to replace the teeth. It goes in the lab for a period of time, and cleaning, you know, if it's a high water, a hygienist can get underneath, or once in a while they can back out the screws and remove the lower, place it in a cleaner, clean the fixtures, and then put everything back in. I think we're right about ready to do a microsection here. Okay, so hold on to that for a second. I'm gonna just, we even had some penetration, so you see the volume now is kind of missing. So that means it's probably gone all the way through the other side, or maybe some of it leaked out. Okay. Now I'm going to test the fracture. You see the topography. If we look real close, you'll see that fracture topography. It doesn't look like we have prior access. If we did, you probably wouldn't see as much of the jagged edges represented in there now. This is going to look like we're going counterclockwise, but looking through a reflective vision, we're able to see the opposite. So let's start to put some pressure on it. And we do see some movement, so that's good news. Now the other question is there a little bent portion of the top of the screw? Is it engaged, or is it all the way through? That's the question. We hope it's engaged. Okay, so we're turning it in the proper fashion. We're about a quarter turn. We might need a bite guard or a bite block for the patient, because his jaw might be getting a little tired from opening it. I'll show you what we use here. This is a styrofoam wedge.
Can I touch it?
You may touch it. All right. Had a little itch. He's okay. And just place this gently. Have you close on that for me? Good job. Yep, just rest on that. Perfect. Going to continue to unscrew this. I definitely feel like we have some thread attachment here, so but we do have to do this very delicately and under high magnification. So I'm going to switch mirrors now, and we'll use a smaller mirror. Feel free to, if you need to, contact me at the office here at 561-391-6290, or you can write an email to me. I'm just going to drop this chair a little bit on the procedure itself. So we have a nice ledge to our little purchase, but we may have to use some oil in there to get it to move a little more freely. So I'm going to use a combination of oil and the more of the dissolving solution called tartar and stain. Again, what we're going to do is apply it with a small brush, and you don't want to get this on tissue. Not that it'll, you know, burn at all, but the patient will feel slightly warm and uncomfortable. So, all right, now I'm gonna move it a little bit in a counterclockwise fashion. Excuse me. And don't really see anything on my brush itself, but we wanted to get that little mix of oil in there. Let's just see if we get a little better movement now. Well, we don't want to see it freezing. You get a frozen situation, then we know we've got issues here. We'll be in it for a longer haul. Hoping that is all we need. Again, just takes time, patience. We've kind of carved out a niche to help the local dentist, and we're able to assist many offices. If your dentist is ready to fold on the implant, at least give us a try. We'll try to help you out with that. Okay. So let's count the threads. You got 1, 2, 3, 4, and 5. So there's 5 threads, and we'll keep counting them as we rotate this. So if you keep the threads clear above the fracture, then you only have to deal with the threads of the fractured screw itself, which probably contain micro fragments of bioburden, which is a mixture of tartar, debris, food, bacteria, and even some dried blood. We'll see that in there sometimes. So I put together a solution that seems to work pretty well. We're happy about it. Process of elimination and trial and error. Finally, alright. Of course, with all that, the surfaces get a little slippery from the oil. There's a nice little purchase. You see that little point right there? I can fit my instrument in there and turn. So I got a good turn on that. Good spot. Yep. Alright. So we're up to thread number 4. So that's good. We are definitely spinning it out. Eventually it'll come all the way out and we'll have that fragment. So the beginnings of a new start for this implant. We're saving the implant and not have the patient go back to surgery, which would take a lot of time, probably a whole year to just graft the site and then place a new implant, and then you're looking at the cost involved in that too. And nobody wants to go through surgery. It's like, only if you have to. Alright, so this is Dr. Gerry Cuomo. I'm definitely going to get this out through conventional means, but it's going to take us a while. And we don't have any time lapse. This is all live video. There's no editing whatsoever. So save you the anguish of watching that. Trust me, this one will be out. I'll have it up on LinkedIn for business and YouTube for educational. Just look at it from my name under Gerard Cuomo, and you'll be able to watch this video, and not only that, but other educational videos as well. Alright, this is Dr. Gerry Cuomo. Thanks for watching. We're in our Boca Raton office for rescue of a Brandemark implant, fractured screw. Definitely going to get this one out today. Hope you all have a good day out there. Nice October weather coming. Enjoy.